Hello, Assalamu alaikum. Welcome back to my channel. We are reading chapter number 6, Ethical and Legal Issues for Nclex RN preparation. So, last time we left the video of collective bargaining. So, we are going to start from here, collective bargaining as well. Listen, guys, it is very important to read sounder book word to word if you want to pass your exam, if you want to be successful in your exam. It is not a joke. We are not wasting our time. Okay, so focus on the words, focus on what I'm saying and I'm reading. This is the first step. When because if you don't read, you don't understand what they want, what they are explaining. So let's start. Collective bargaining. Collective bargaining is a formalized decision making process between representatives of management and representatives of labor to negotiate wages and conditions of employment. When collective bargaining breaks down because the parties cannot reach an agreement, the employees may call a strike or take other work actions. Striking presents a moral dilemma to many nurses because nursing practice is a service to people. Here again, this is a pyramid to success. It is very important, 99% chance that it is going to be tested in your exam. Legal risk areas. Assault. Assault occurs when a person puts another person in fear of a harmful or offensive contact. This also constitutes an unwelcome contact with an other person. 2. The victim fears and believes that harm will result because of the threat. Battery is an intentional touching of another's body without the other's consent. Pay attention on these words. Invasion of privacy includes violating confidentiality, intruding on private clinic or family matters, and sharing client information with unauthorized persons. False imprisonment. I'm sorry, guys, if I have a little bit pronunciation problem. As I said, English is not my first language, so might be I could pronounce a little bit wrong, but you have a spelling here, imprisonment. That's why I said I'm not so clever, intelligent, but I pass my NCLEX, and if I can pass, everyone can pass. So, false imprisonment occurs when a client is not allowed to leave a healthcare facility when there is no legal justification to detain the client. False imprisonment also occur when restraining devices are used without an appropriate clinical needs. As some people, those they are working in UK and some those they are working in Europe, they know that they have a restraint policy to restrain the client when they are aggressive or when they are doing unusual things. Sometimes they are going to make harm for others, and they are on risk to harm themselves as well. So there are some restraint policies. So here they are mentioning that you cannot restrain without an appropriate clinical need. A client can sign an against medical advice form when the client refuses care and is competent to make decisions. So there are in hospitals some against medical advice referral forms when patient refuse. Sometimes even where I am working, sometimes patient refuse to catheterize, sometimes you refuse to have oxygen therapy, then we always fill that form. The nurse should document circumstances in the medical record to avoid allegations by the client that cannot be defended. So you have to document everything, every circumstances. Okay, let's go again. Here you see chapter number 6, ethical and legal issues. Okay. Defamation is a false communication that causes damage to someone's reputation either in writing, libel, or verbally slander. F. Fraud results from a deliberate deception intending to produce unlawful gains. There may be exceptions to certain legal risk areas such as assault, battery, and false imprisonment. So, might be in your exam, it can be It can be, they give a scenario. They will ask about battery, false imprisonment, assault. When caring for client with mental health disorders experience acute distress who pose a risk for themselves or others, in this situation the nurse must assess the client to determine laws of control and intervene accordingly. The nurse should use the least restrictive method initially, but then use interventions such as restraint of the client's behavior indicates a need of this intervention. So, guys, we have read very important topic, as it was the pyramid of success, and you have learned about imprisonment, false false imprisonment, battery, and assault. Let's continue this. This is again pyramid to success, very important. Patient care partnership. I know that this is really boring and you may feel sleepy, but guys, if you want to be successful, it is important to read carefully. How you like to read, it's up to you. Sometimes some people like to listen, sometimes some people like to sit down in a calm and quiet environment and they read themselves. It's up to you guys. So let's we start again. Patient care partnership. If you really want to be successful in your exam, I'm again and again repeating so many times that it is important to understand what they are saying. So we go again. Patient care partnership description. The document created by the American Hospital Association informs clients about what they should expect during their hospital stay with regard to their rights and responsibilities. The document is formally known as the Client's Patient's Bill of Rights and reacts acknowledgement of a client's right to participate in their healthcare within emphasis on client's autonomy. For specific information, see American Hospital Association 8. Here it's a website. Again, those candidates they want to go for this website, it is mentioned here. Number 4, the patient care partnership protects the client's ability to determine the level and type of care to received. All healthcare agencies are required to have a patient care partnership posted in a visible area. Number 5, several laws and standards pertain to the patient care partnership and client's rights. Box 6.3, we are going to read. Rights for the mentally ill. Again, guys, be careful. Mentally ill. We are going to read rights for the mentally ill. The Mental Health System Act created rights for mentally ill people. Number 2, the Joint Commission has developed national patient safety goals for the Behavioral Healthcare and Human Services Program. Refer to, then there is a website again. Those the candidate they are interested to go on this website, it is mentioned here. Psychiatric facilities are required to have a patient care partnership document posted in a visible area. Again, here you guys will think that I'm saying again and again everything is very important for you guys to listen carefully. Organ donation and transplantation. A client has the right to decide become an organ donor and the right to refuse organ transplantation as a treatment option. Number 2, an individual who is at least 18 years old may indicate a wish to become a donor on the individual's driver license, state specific, or in an advance directive. So they have some laws. Maybe in a driving license they have mentioned the donor or not. So it is mentioning here that if patient has fully right to choose. Number 3, the Uniform Anatomical Gift Act provides a list of individuals who can provide informed consent. They are talking about some laws of USA because you are going to become a USRN, so you should know about these laws. So here again we are going to read box number 6.3, laws and standards. American Hospital Association issued patient care partnership formerly Patients' Bills of Rights, American Nurses Association, developed the Code of Ethics for Nurses, which defines the nurse's responsibility for upholding clients' rights. Mental Health System Act developed right for mentally ill client. The Joint Commission developed policy statement on the right for mentally ill individuals. American with Disabilities Act prohibits discrimination against an individual with disability in all areas of public life. So again, this is the law and standards we are reading here. Affordable Care Act, characterized by consumer rights and protection, affordable health coverage, increase access to care and quality care that meets the need of clients. So, this box I have read, but we were reading about the donor organ donation and transplantation. So, we will continue this. I will continue the sentence. Number 3, the Uniform Anatomical Gift Act provides a list of individuals who can provide informed consent for the donation of a deceased individual organs. The number 4, the United Network for Organ Sharing set the criteria for organ donation. Number 5, some organs such as the heart, lung, and liver can be obtained only from a person who is on mechanical ventilation and has suffered brain death, whereas other organs or tissue can be removed several hours after death. So, here again, as a nurse, you should know that some organs such as the heart, lungs, and liver can be obtained only from a person who is on mechanical ventilation and has suffered brain death, whereas other organ or tissues can be removed after several hours after death. Look here. A donor must be free of infection, disease, and cancer. Of course, you are having a organ from someone who should be healthy. Number 7, requests to the deceased family for organ donation usually are done by the primary healthcare provider or a nurse specially trained for making such requests. Donation of organ does not delay funeral arrangement. No obvious evidence that the organs were removed from the body shown when the body is deceased. So look here again, it is very important. You should know as a nurse, donation of organs does not delay funeral and arrangement. No obvious evidence that the organs were removed from the body shows when the body is rest. And the family incurs no cost for removal of organ donated. Number 9, cultural and spiritual belief. Refer to chapter 19 for information regarding end of life here. So this is obvious. We should know about some cultural and spiritual beliefs, and we always follow that. So now guys, again this is pyramid to success. In this chapter there are a lot of these pyramids that we have to focus on. So consent, we are going to read now. Consents description. Consent or releases are legal documents that indicate the client's permission to perform surgery, perform a treatment or procedure, or give information to a third party. Number 2, there are different types of consent. Box 6.4 we are going to read later on. Number 3, informed consent indicate the client's participation in the decision regarding healthcare. So, it is the client's approval or that of the client's legal representative to have the client's body touched by a specific individual. Number 4, the client must be informed in understandable terms of the risk and benefits of the surgery or treatment, what the consequences are for not having the surgery procedure, perform treatment options, and the name of the PHCP performing the surgery or procedure. If a client is deaf, illiterate, or speak a foreign language, a professional interpreter must be present in person or remotely to explain the terms of consent. So guys, it is very simple. All we are nurses here and we are reading Nclex RN, but this is very common in each and every healthcare setup, that consent, you know, the consent before any procedure or any if you are going to do anything, you always ask consent. So they are mentioning about this A client questions about the surgery or procedure must be answered before the client signs the consent. A consent must be signed freely by the client without threat or pressure and must be witnessed. The witness must be an adult. If unable to sign a consent in person, it can be signed with the next of kin over the phone with a second nurse present as a witness. So, again, as a nurse, it's a very big responsibility. A client who has been medicated with sedating medication or may other medications that can affect the client's cognitive abilities must not be asked to sign a consent. Of course, they are not alert, so we will not ask a consent. Legally, the client must be mentally and emotionally competent to give consent. If a client is declared mentally or emotionally incompetent, a next of kin appointed guardian appointed by the court or durable power of attorney for healthcare has legally authority to give a consent. Box 6.5 we will read later. Number 11. A competent client 18 years of age or older must sign the consent. In most states, when the nurse is involved in the informed consent process, the nurse is witnessing only the signature of the client on the informed consent form. Number 13. An informed consent can be waived for urgent medical or surgical intervention as long as institutional policy or indicates. Number 14. A client has the right to refuse information and waive the informed consent and undergo treatment, but this decision must be documented in the medical record. Number 15. A client may withdraw consent at any time. See clinical judgment take action box. Here again, we are going to read this important red bullet point. An informed consent is a legal document and the client must be informed by the PHCP, for example, physician surgeon, in understandable terms of the risk and benefits of surgery, treatments, procedures, and plan of cares. Care. The client needs to be a participant in decisions regarding healthcare. So it is very important PHCP, a physician or surgeon, has to take consent. In terms of simple language, note they will use a medical term and then common people cannot understand this medical terminology. So it is important to having a consent before taking a consent to use simple and normal language that patient and can understand easily, and then they give consent. So here we are going to read boxes. So box 6.4, types of consents. Admission agreement. Admission agreements are obtained at the time of admission and identify the healthcare agency's responsibility to the client. Immunization consent. Immunization consent may be required before the administration of certain immunizations. The consent indicates that the client was informed of the benefits and risk of the immunization. Blood transfusion consent. A blood transfusion consent indicates that the client was informed of the benefits and risk of the transfusion. Some clients hold religious beliefs that would prohibit them from receiving blood transfusion even in a life-threatening situation. Surgical consent. Surgical consent is obtained for all surgical or invasive procedures or diagnostic tests that are invasive. The primary health care provider, surgeon, or anesthesiologist who performed the operative or other procedure is responsible for explaining the procedure, its risk, and the benefit and possible alternative options. Research consent. The research consent obtained permission from the client regarding participation in a research study. The consent informed the client about the possible risk, consequences, and benefits of the research. Here we are reading special consent are required for the use of restraint, photography, decline, disposal of body parts during surgery, donating organs after death, or performing an autopsy. So you have read about types of consent in Nclex. This is not only for Nclex. In your nurses, if you are working in hospital in clinical setting, you should know about this all consent we do. This is all something like we do in every day in our work setup. So now we are going to read box 6.5, mentally or emotionally incompetent clients. So, mentally or emotionally incompetent clients declared incompetent, unconscious, under the influence of chemical agents such as alcohol or drug, chronic dementia, or other mental deficiency that impairs thought process of ability to make decisions. Then again, I have said you this clinical judgment take action we are going to read. This is very important to understand. It is nothing, you can just do the practice of question. You have to understand background of the question, background of this all content that what they wanted to explain you. So clinical judgment take action. 1 hour before a scheduled surgical procedure, the client states to the nurse, I have changed my mind. I don't want this surgery. Actions to take by the nurse include the following. Let's go and read carefully. Talk to the client about the request. Explore with the client concerns about not wanting the surgery. Withhold further surgical preparation and contact the surgeon to report the client's request. So document the client request and that the surgeon was notified. This is your action as a nurse you have to take if some client refuses to have a procedure. So we are going to read now about minors. Yes. So here we go and read about minors. A minor is a client under legal age was defined by state statute, usually younger than 18 years. We all know less than 18 years of age, we say minors. A minor may not give legal consent and consent must be obtained from a parent or legal guardian. Agreement by the minors is important because it allows for communication of the minor's thought and feelings. Number 2, parental or guardian consent should be obtained before treatment is initiated for a minor, excepting the following cases in an emergency in situations in which consent of the minor is sufficient, including treatment related to substance abuse, treatment of a sexually transmitted infection, human immunodeficiency virus, testing and acquired immunodeficiency syndrome, treatment, birth control services, pregnancy, psychiatric services. The minor is an emancipated minor or a court order or other legal authorization has been obtained. Refer to the, again this is Guttmacher report on public policy for additional information. Here you have to go. Then you understand about this. Hopefully this is parental and guardian consent, and then about the minor. So we are going to read emancipated minor. I apologize for my pronunciation if I'm doing pronounce wrong. As I said, I have done self-study myself, so I did it like that. Emancipated minor. An emancipated minor has established independence from the parents through marriage, pregnancy, or service in the armed forces or by a court order. So you should understand now emancipated minor. An emancipated minor is considered legally capable of signing and informed consent. So guys, here I will end my video. I think it is enough for today, and you should know about these all important concepts of Nclex. The next video we will start from Health Insurance Portability and Accountability Act. Again, you will see here this sign. It is very important. So just I would like to inform you guys that I have done self-study Nclex and I have passed my Nclex in first attempt. What I have done, what tips and tricks I have used, I am using the same one here. I'm trying to explain everything what I have done, because when you read this you will know the background of the study and then you will grip the question. If they ask you question about your cognitive ability or your clinical judgment, they will use this all steps by different scenarios, by different clinical study, and then you will realize that how important it is to read the Nclex RN Saunders book. So we will start next video in health insurance. For now, I will say bye. See you. Do subscribe my channel, support my channel, because I am really enthusiastic to explain you what I have learned from Nclex. Bye and see you in next video.